In recent years, remarkable advances in the treatment landscape of lung cancer have changed the way we approach this complex and often devastating disease. From targeted therapies and immunotherapy to novel surgical techniques and precision medicine, the field of lung cancer treatment has witnessed unmatched progress, offering new hope to patients and healthcare providers alike.
As we all know, many of the newer therapies are coming up in the oncology treatment, and lung cancer is one of the malignancies where we are seeing a lot of breakthrough targeted drugs, and which have led to a very significant increase in the progression-free and disease-free survival of the patient. So in targeted therapies, so if we divide our treatment into adjuvant, neoadjuvant, or in the maintenance or in the metastatic setting, so in the adjuvant setting, specifically for patients with harboring EGFR mutations, we have maintenance osimertinib, which has prolonged the progression-free survival in these patients. And apart from that, in metastatic settings for EGFR, ALK, ROS, MET, RET, NTRK, HER2, and BRAF mutations, we do have various targeted agents for each of the separate mutations, and which has almost doubled the progression-free survival in metastatic patients.
In the fight against lung cancer, early detection stands as a critical cornerstone for improving survival rates and treatment outcomes. With advancements in technology and research, promising developments in early detection methods have emerged, offering renewed hope in the battle against this formidable disease.
Recently, the previous trials which were determined to check for the early disease, so they were using low-dose CT scan. But apart from that, on chest X-rays, we have now AI algorithm with us, who are by the name of Cure AI, so which are detecting lung lesions in quite early phases, and it has been employed in multiple hospitals across India. And recently, the study has proven that it is equally good if employed to a general hospital. It can detect lung lesions in a very early phase, and it is very promising.
Traditionally, lung cancer has been associated with limited treatment options and poor prognosis, particularly for advanced stage disease. Conventional treatments such as chemotherapy and radiation therapy, while effective to some extent, often come with significant side effects and limited efficacy in controlling tumor growth over the long term. However, the advent of immunotherapy has ushered in a new era of hope and optimism in the fight against lung cancer.
To bring the role of immunotherapy, I would like to start with initially the treatment for lung cancers included surgery, traditional chemotherapy, and radiation. That are the only three options we have, but over the period of years, we have targeted therapy as well as immunotherapy with us. So again, if we divide treatment into three categories, with the neoadjuvant chemoimmunotherapy, we have nivolumab, which has shown very good pathological complete response rates, and with these response rates, the survival is also expected to be long after the surgery. Similarly, in adjuvant setting, we have atezolizumab and pembrolizumab with us, which has also prolonged the progression-free, disease-free survival in many of the patients. And if we talk about those patients who are unresectable but still localized, they were previously treated with chemoradiotherapy, and now we have maintenance immunotherapy for them, which has almost doubled the progression-free survival or disease-free survival in such patients. Definitely, immunotherapy has entirely changed the landscape of the patients with lung cancer, which we are treating as well.